Good afternoon. Thank you all for being here today on Thursday. It's another day that the hurricane is not in the Gulf of Mexico, so that's a good day. But we will continue to monitor that, and Director Michelle will give us an update on that in just a little while. We had better numbers today. Dr. Byers is here in Dr. Dobbs' stead, and he'll talk specifically about them. But we had better numbers today than we had yesterday. We were back under the 1,000 case mark, and we know on Wednesdays and Thursdays and sometimes on Fridays the numbers are higher than they are on the weekends. But it's good news, but it's not victory. We have to keep working. We have to keep making an effort. We have to work together, and if we do, we will be able to get through these challenging times. I want you to know that I am signing an executive order today to govern how college football stadiums will be able to operate this fall. I know it's a topic that we constantly get questions about. It's something that's been polarizing around the country. Some conferences have opted not to make any effort to play. Some states have not yet put out their plans. This is an effort which we worked closely with the universities on to set a floor. We took their joint recommendations, and with a little bit of work, we put this plan together. This is the minimum that each school is required to do in their college stadiums this fall to keep our players and our spectators safe while allowing college football to occur. As you know, the University of Southern Mississippi, for instance, has a game in 2 weeks on a Thursday night. Could perhaps be one of the earliest football games that occur this fall. And then the Southeastern Conference is scheduled to begin September 26th. But we wanted to put out the plans, give everyone some time to review, and also to be able to implement them. First, and probably most importantly, seating capacity in the bowl area will be limited to a maximum of 25%. If and only if schools can ensure a minimum of 6 feet of social distancing between people who are not in the same household. Masks will be required whenever you're walking around, whenever you're entering, or when you're exiting the stadium. Basically at all times, unless you're sitting in your seat away from everyone else. And it will be highly recommended that even if you are sitting in your seat, that you continue to wear a mask when at a ball game. We are limiting elevators to 5 individuals per car, asking schools to use grab-and-go food for concessions, and instructing them to make hand sanitizer available throughout the stadium. Clubs and suites will basically be governed by all of our limitations on restaurants. Only essential personnel to gameplay will be allowed on the sidelines, and all entry and exit gates will be open to prevent anyone from clustering. So in other words, if you have 40 gates in a stadium, even though capacity is limited to 1/4, it will be required that every gate is open so as to ensure and limit clustering. Lastly, and I'm sure this will not be popular, there will be no game day social gatherings outside of the stadium, rallies, parties, or tailgates. I know this will not be popular. It's no fun, and I'll miss them terribly myself. But it's better than the other states prohibiting football altogether. I'd still rather be in the SEC with no tailgates than the Pac-12 or the Big Ten with no football. I spent the afternoon talking about these restrictions and other measures to prevent the spread on college campuses with our university leaders as well as our local leaders in our college towns. We know that we've got a lot of work to do there. I know that one of Dr. Dobbs' greatest fears heading into the fall, college students partying and ignoring the risk of the virus. It's something that we will have to be constantly working on over the course of the next few months. We are having cases on our college campuses, and that is not a surprise. What we must do is, as we see cases, is continue to work with Dr. Dobbs and Dr. Byers and his team, the leadership at the universities, to make sure that those who test positive are isolated, those with whom they have come in close contact are isolated, so that we can ensure that we limit the spread. I do want to urge all of our parents and grandparents that are watching today, if you have kids in college, reach out to them. Tell them to please be careful. Tell them to not be partying, because that's where so much of the spread has occurred throughout the summer. Our 18 to 29 demographic has between 17 and 18,000 cases now in our state. They're 1.5 times larger than any other demographic in the state. So please talk to them about being smart, about being healthy, and about protecting themselves, which ultimately will help protect their moms, their dads, their grandmoms, and their granddads. I do feel hopeful that the group that we've got working on this can and will have an impact. Before Dr. Byers dives into today's numbers, I also wanted to quickly share that today Mississippi will be applying for the additional lost wages assistance from the Trump administration. We'll be able to use our current payments as the match, and we'll see how it works for the next few weeks. That will be back paid through the beginning of August, starting in a few weeks when the process to stand up this new program is complete. I want everyone in Mississippi to know that I'm incredibly grateful for President Trump stepping in, and I hope this will help families in need. I also want to reiterate to the people of our state, if you are unemployed and you have an opportunity to go back to your job or to get another job, please do so. These benefits will run out. We don't know exactly when at this time, but there is a maximum amount of money that the administration can legally spend on this additional assistance. And I anticipate that it will, if a number of states follow our lead and apply for this additional assistance, it is highly likely that the money will run out. So if you have a job, if you have an opportunity to go back to your job, please take that opportunity because Mississippi's maximum unemployment benefit is $235 a week. That is certainly difficult for families to get by on. So with that, I'm going to turn it over to Dr. Byers, who's going to tell us about the numbers today.
Thank you, Governor. So today the Department of Health is reporting an additional 894 cases, along with 27 additional deaths. 2 of those deaths are from vital records or death certificate reviews, and those 2 deaths occurred between July 24th and August 9th. When you look at our other indicators besides cases, if you look at the numbers of cases that are reported in hospitals now, we are seeing some downward trends in those numbers of confirmed cases. We've also seen some downward trends in the number of individuals who are in the ICU due to COVID. However, we have today seen a little bit of an upward trend in our individuals who are on ventilators. We hope that that trend doesn't continue, but it's certainly something that we need to watch closely. We still have a lot of outbreaks in long-term care settings, but I think that we're looking at a point now where we may start to see some movement in those, and hopefully we'll start to see some decreases in the number of long-term care outbreaks over the next coming couple of weeks. Certainly that's something that we're going to continue to watch and help those long-term care settings with support and guidance as best we can. Schools, when we are working very closely with K through 12s. We have set up a system throughout the state where we have teams that are available from a local setting to be able to support the schools, to provide them guidance, to be able to answer questions. And we've started this now for about a couple of weeks, and really we've received almost 150 calls from schools so far. The vast majority of those calls are asking about specific situations. We have a case, what do we need to do around it, or just in general, the guidance. And we've been there to help them walk through that guidance. And I have to tell you that I have been particularly encouraged by the schools that we've talked to, the principals, the superintendents, that they are adhering to the Department of Health's K through 12 guidance. And I think that, that's a good thing, and that we're making progress with that. One of the sort of unencouraging things is the fact that many of the cases that we're seeing in the school settings are not necessarily transmission within the school, but are in parties outside of the school setting, are in sleepovers outside of the school setting. And, you know, I would encourage everybody that if we want to continue to have those schools functioning, if we want to continue to have on-campus classes and have those kids educated, that we need to do our part outside of the school setting too. When the kids are in the classroom, the schools, by and large, are doing a very good job of keeping those children social distanced and wearing their masks. But it's outside of that school setting that we really want to pay attention to and make sure that those kids don't become exposed and infected outside of the school and then bring it back into the school. Y'all know that we've set up a system of reporting from the schools. We are receiving aggregate reports from all of the schools. We're still onboarding that, and this week we've received about 450 schools that have reported to us. We're asking them to report to us on a weekly basis. If we just look at a quick snapshot of the data for what we've had reported from schools so far this week, the schools have identified almost 2,000 kids that they've had to quarantine as a result of exposures in the school setting, and about 200 individual cases that have been reported through this system. So we've still got some work to do to continue to get other schools onboarded to report to us. We're going to be releasing this data by county soon, so hang on for that. We've still got some work to do with several of the schools to try to get this reporting complete, and so we'll be doing that. So look for that clarity as we move forward. Colleges and universities, we're continuing to work with them very closely. There are a number of cases that have been identified in college and university settings. Much of what we're seeing in those settings is very similar to what we've seen with the K through 12s, where it's the outside activities. It's the outside social activities. It's going to the bars and restaurants. It's hanging out with friends. And it's not continuing to do those things like masking and social distancing. And again, I would encourage the college students that one of our prime goals to go to college is to receive an education. I remember being 20, it's been a long time ago. But you know, I would urge them, if we want to be serious about this, that we have to not only be serious about those appropriate actions on campus when we're in class, but we need to do that when we're off campus as well. Because when anybody gets infected, not only does it impact them, it impacts those people around them. And for those individuals who are trying to do the right thing, who are exposed, it may result in them being quarantined for 14 days. And we want to try to avoid that. So I would encourage everybody just to keep moving forward with doing those activities that we know to do. Please wear a mask when you're out. Please social distance. Stay 6 feet apart. In the long run, that's going to help us maintain some of these activities that we're trying to do. Thank you, Governor.
Thank you, Dr. Byers. Just to give you a few numbers in addition to that, as we talked about, hospitalizations and patients in ICU beds and patients on vents are a lagging indicator, and we have been saying for weeks that we believe that as our numbers come down, a few weeks later our hospitalizations will follow, and we're seeing that now. Our confirmed patients with COVID-19 in hospital beds reached a peak just shy of 1,000. It was 852 today. Our total number of patients that is suspected COVID positive plus confirmed COVID positive peaked at approximately 1,250. That number's at about 1,025 today. So again, down 15 to 20% from the peak. If you look at things such as patients in an ICU, this is an area where we were very concerned about and can remain concerned, but that number peaked at approximately 337 several weeks ago, and today it was at 276, approximately 60 fewer patients in ICU rooms with COVID, and that's a positive. So what does that mean? That means that what we're doing is working, but that means we've got to continue doing it, and we've got to be even more vigilant, and the next 2 weeks are critical. The numbers today, Wednesday and Thursday, compared to last week, we're actually up on a 2-day period. The Wednesday, Thursday this week were more than the Wednesday, Thursday last week. Not by a lot, but they were up. And so we hadn't seen the 10, 15, 20% declines. It could just be reporting, and we'll monitor it closely, but let's watch over the next 3 or 4 days because we need to continue to see numbers decline so that community transmission is declining, so that we can continue to drive hospitalizations and other important measures down. With that, I'm going to turn it over to Director Michelle.
Thank you, Governor. Good afternoon, everyone. Want to report some slight changes in systems that we were tracking yesterday that were both of these systems are now slated as tropical depressions, which means they have elevated in their intensity slightly. We'll start off with Tropical Depression 14 that was 97 yesterday. That is the system that is moving along a more southerly course. It is projected to make its way across Honduras sometime late tomorrow, and then it would hit and come across make landfall in the northern part of Mexico sometime very early Sunday morning. This storm is expected to disrupt somewhat as it goes across Mexico. What happens when it gets out into the Gulf is uncertain right now, but we're pretty certain, given the models tracking the storm, that it will make landfall somewhere along the southwestern Texas coast or as far around as the southeastern Louisiana coastline. Again, currently this system not projected to make a direct landfall on Mississippi. Depending on the intensity and what it does, we will certainly have some effects. The second system is one that I'm more concerned about at this particular time. It's Tropical Depression 13. It was named Invest 98 yesterday. This system is approximately a day or two behind the system we got, working a more northerly track. It is projected to be in the vicinity of the Dominican Republic at some point in time early Sunday morning as it tracks its way to the northeastern portion of Cuba and expected to make landfall somewhere in the vicinity of Florida very early Tuesday morning. From there, a lot of the models show that storm making a northeasterly hook back out up along the east coast, potentially out into the Atlantic. But the concerns for me are there are a few models that do show that system coming across the Florida and into the Gulf of Mexico, and then from there it could pose to be a serious threat for Mississippi. So just a reminder to everyone, there are a number of distractions that everybody's dealing with now with COVID, kids going back to school, so forth and so on. It is important that you remember to check your emergency supply kits, make sure that you have a plan and a place to go if you are needed to evacuate. And as a reminder, with COVID and occupying congregate shelters, the risk of exposure is increased there, and we want to make sure that we utilize those only in cases that are most important, but have a plan to please evacuate. Quick update on COVID. Real quickly, PPE deliveries are continuing to go out. As of tomorrow, we will have delivered to 90 Tier 1 facilities. So again, great Herculean effort by our soldiers, men and women of the Air and Army National Guard in supporting that event. Finally, update on the Mississippi Emergency Relief Program. Total applications up to date, just over 700 at 705, and total project submissions of about 29 and upwards of $13 million in those. So we still got a ways to go, encouraging the counties and municipalities to get those applications in. And then finally, on Census 2020, just a plug on that, please make sure that you participate in the census because that plays a big role in how the disaster grants are tabulated for states. Very important for Mississippi. Governor, that concludes my update, sir.
Thank you, sir. Questions? Yes, sir.
Can you clarify what you mean about the seeking the federal assistance? Are you saying that state's going to apply for the $300 and you're going to add the $100 $100 to what the president said he's gonna
So
extend?
my team, and I give great credit to our team at Employment Security and my governor's office staff, they have been working tirelessly over the last week to learn the details. I would also commend Director Michelle and his team because, as you know, the way in which the president was able to do this is by using the Stafford Act. In conversations with the U.S. Department of Labor as well as with FEMA, what they have assured us of is that the $100 required match, because it's a 75-25, can be covered by existing payments that are being paid to these individuals from state unemployment insurance. Therefore, if you were eligible for the pandemic unemployment assistance, you're not automatically eligible for this new amount. You have to have been laid off from COVID, and the Employment Security will be sending a press release regarding this here shortly. Again, we have to apply and get approved, so it is not a done deal. We're announcing today that I have directed Employment Security to apply, which we anticipate that we will be approved. But the end result will be that if you are eligible to receive it, whereas you were receiving $600 additional, you will receive what you are entitled to under state unemployment. And by the way, you have to make at least $100 per week to be eligible according to the federal guidelines. You will get an additional $300. So there will not be an additional state match in addition to the $300 in federal money. So you'll get $300 more. So you had $600 more up until the end of July. If we get approved and you are eligible, you will get $300. It will be backdated to August the 1st, and then you'll get $300 a week. I will tell you, again, I can't reiterate enough that the money is going to run out. There is only, I believe, $75 billion that the administration had. You'll recall that the reason the president stepped up and did this is because there was no agreement in the Congress to further fund that program, and so he utilized the Stafford Act to extend it. But it will be a maximum of $300 additionally for those that are on unemployment and are on unemployment because of COVID-19.
Why didn't you wait 3 weeks to apply for this, to try to get that?
Well, I didn't wait
extended?
3 weeks to apply.
Benefits ended at the end of July.
The benefits ended at the end of July. The president did not make this available until about a week and a day or so ago. So this was announced about the second week in August, towards the end of the second week in August. It's going to take, if we are approved, it will take probably a week to 2 weeks at least to get our computer systems recalibrated such that they can send it out. In fact, it may take as long as 3 weeks. But if the individual is eligible, the money will be available to them effective, backdated to August the 1st. Yes, sir.
Dr. Byers, could you clarify, you said that I guess it's a program that schools have to use to report numbers to the Department of Health, is that correct? Or can they not just call the health department and say we have these numbers?
So what we're doing is we're asking the schools to report to us aggregate numbers on a weekly basis. Certainly, schools can call us, and we get a lot of calls from schools to not only report cases, but to ask for additional guidance and clarification. But we do have a system that's an organized system for schools to be able to report certain data elements to us on a weekly defined time frame so that we can have visibility, but we can also help those schools as needed.
Cornelia, did you have a question?
Yes, talking about colleges, I know that we've talked through what the guidelines are for K through 12 in terms of if there are 3 cases within 3 classrooms within 3 activities, then that's when the state might have a conversation about closing. What is the guidance for the college setting, since you do have folks living on campus and things like that? At what point does it become a conversation of what do we need to do to control this?
Yeah, well, I think if the question is what do we need to do to control this, the point at which that conversation is had is every single day. But we also realize that while we have about 400,000 kids in K through 12 institutions. We have approximately 1,000 campuses. At Mississippi State, for instance, they have 21,000 people on the campus of Mississippi State at any one time. And so, whereas in a classroom setting, we talk about more than 3 cases in any one classroom in the K through 12, well, that doesn't necessarily apply to a university campus that is hundreds of acres large. And so we're certainly going to work very closely with respect to identifying cases and quarantining and isolating those that need to be isolated. And we committed on the call earlier today to I committed to the university presidents because they do want more guidance in terms of what does it look like and at what point would we need to talk about the potential of going virtual or whatever. We don't have definitive answers to that right now. We went through and I talked to all, not virtually most every university president of the public schools today. I heard the numbers. They're very knowledgeable. They're much like I spend 90% of my day working on COVID. My guess is that if you go to USM or to Alcorn or to Jackson State, their presidents are spending about 90% of their time dealing with these issues, and so they're on top of it. I'm confident that they are doing the right things, and I'm confident that, as is often the case, when the kids are in the classroom, the likelihood of COVID transmission is fairly slim, and while they're on the campus going to and from classes, the likelihood of transmission is fairly slim. The challenge is when you get outside the campus, when you go into the towns and you go to the bars, and those are the challenges that we've got to deal with, and certainly it's going to be a new day every day, and we're going to deal with them as they arise.
Speaking of in the towns, is there a concern, or will there be more discussions with those? You mentioned speaking with the leaders in the communities where the colleges are located. Will there be a concern of enforcement? For example, Ole Miss, the Grove would be closed, but that the square might get crowded, or the Cotton District, even though the junction is closed. Is there a concern about enforcement that people will still want to be there and be part of some sort of game day atmosphere?
Sure, there is concern. I will tell you that I am absolutely convinced that the university police departments, as well as the local communities police departments, are working hand in hand to enforce the measures. We actually heard from them today and heard of the number of citations that have been issued, not only for those who are not adhering to the social distancing guidelines, those who are not adhering to the requirements that you have to be seated in a bar, for instance, but also for university participants and kids that are having unsanctioned parties out, off campus that violate the number of individuals you can have for social gatherings. And I will tell you, I was very pleased that virtually every university in Mississippi has put together measures whereby a violation of our executive orders are going to go on their college record, and they have teeth, and there will be kids that if they completely ignore it, they're going to have disciplinary action, and potentially even becoming expelled. And so the fact is, our universities are being exceptionally proactive in dealing with this issue. Dr. Dobbs and Dr. Byers and myself, we're very concerned about it because we've seen what's happened in the 18 to 29-year-old age group. But the reality is, whether they're in Starkville or Oxford or Hattiesburg or on the campus down at Lorman, if they are out partying, whether they're in school and in the classroom or they're back home, they're susceptible to getting the virus, and we've really got to work very hard to make them as aware as possible of the risks that are involved. Renee?
We have June with Jackson Free Press has a question. Yes, my main question is for Dr. Byers, but I had a real quick first one for the governor. I wanted to clarify, Mississippians making less than $100 in unemployment will not be eligible for the pandemic funds. Is that what you were saying?
My understanding is that is federal guidelines. If you make less than 100, that you are not eligible for the additional 300. Unlike the previous program, which was passed by the Congress, in which you were eligible for the 600, but obviously the president was limited by existing statutes because the Congress couldn't come together and make a plan. But yes, my understanding is federal guidelines do not allow for those making less than $100 a week to be eligible.
Thank you. Dr. Byers, I'm hearing from some schools where students are quarantined if a certain number of students in a cohort, meaning class, sports team, bus, usually 3 test positive. Well, what that means for some of these schools is what I'm hearing, is that if only 1 or 2 students come through the class and test positive, that all the students exposed to that individual continue coming into in-person classes. Is that following MSDH's guidelines? And on your end, are you speaking to schools that are using that approach?
So when we're aware of schools that need additional guidance and clarification, certainly we're speaking with them. Our guidance is for if there's one student that exposes individuals and our exposure is again 6 feet or less for 15 minutes or longer, then we recommend that those students be quarantined, and that means exclusion from the school setting for 14 days. And so that is our guidance. If we run into a situation where there's 3 or more cases in a group setting, a defined group, that would be considered an outbreak or a cluster. And under those circumstances, we would recommend that whole group be under quarantine. So we do have these guidance out there, and like I said, by and large, the schools that we've spoken to have been following this guidance and have been taking the initiative to do this guidance and to follow it as best they can. And when they need clarification, they're giving us a call, and we're helping them with it.
Yes, sir.
Hey, Governor, when it comes to students, will they be getting any kind of priority for as far as seating goes in these games? And will the limitation requirements also apply to like the boxes where private donors would have been sitting?
Yes, there will be unique limitations whether you are in bowl seating or club areas or in the suites. They each have different guidelines based upon whether you're in one of those 3. And with respect to students getting seating priority, I'm focused on public health, and public health is about the number of people that are gathering. Who actually gets in the stadium is going to be determined by the individual schools. We'll make those decisions. Yes.
Dave Elliott with WLOX has a question.
Thank you, Renee. I'd like a clarification and then I have a question for the governor, if I may. Governor, Southern Miss kicks off September 3rd, SEC starts September 26th. Your stadium order runs till August 31st. I presume that's some kind of procedural legal matter. You'll just extend once we get to the 31st, right?
That would be the expectation. The reason it goes to August 31st is because this actually amends and is consistent with the other EOs, and they all go until August 31st. So it's simply for consistency's sake that it goes to August 31, and the expectation would be to continue to extend it, of course, unless things need to be changed.
Okay, I'm sorry, Governor. A casino employee union looked at 2 casinos and issued a report. Among other things, workers have reported a risk of potential exposure. Inspections found casino patrons not following rules. Only 19% surveyed thought their employer was doing enough. And then they made recommendations, I believe today, to the Gaming Commission. And people are going to ask me, what's the governor going to do with the casinos? What's he going to do? This is kind of a good opportunity for you to remind Mississippians. The Gaming Commission is very autonomous, isn't it? Not a function of your office. They can basically set policy within reason. What authority do you have over the industry?
Well, I think that I have the authority to do whatever is necessary to protect the public health, as does Dr. Dobbs. But we've worked very closely with the Gaming Commission. We have been in consult with them, and quite frankly in agreement with every decision that they have made up until this point. And while I haven't seen this report, I'll definitely take a look at it. But they do have the ability. They are the regulator for the industry, and so they have the ability. And in our very strong working relationship with them, we've been in agreement thus far, at least in the first 7 months of this pandemic.
Hunter Dawkins with the Gazebo Gazette has a question.
Thank you, Renee. Thank you, Governor. I have two questions. First question, Governor, would be, I'll ask and then I'll finish with the next one. As far as, I haven't read the executive order and the exact portions, but after the football games are completed, is there going to be any type of keeping from gatherings, fans on the field, all that little criteria all the way across the board? Because as after college football games, it's a pretty huge gathering for quite a while. And my second question is for you, Mr. Michelle. How are we doing with the shelters? Do we have everything available still, or is there social distancing, at least among the criteria?
Thank you very much. The executive order that is going into effect actually amends our Executive Order 1492, and I'm just going to read this to you under subparagraph O, item number 2. All game day, event day, social gatherings outside college and university stadiums shall be strictly prohibited. This prohibition applies to all tailgating, picnics, fanfare areas, and the like.
Hunter, to your question regarding shelters, so yes, the shelters, as we've discussed in the past, the CDC guidance remains unchanged, and those managers of those shelters, so basically the capacity in those shelters are going to be reduced by some 50 to 60% in a lot of cases, which means more shelters be required if the same number of people would seek shelters, which is why that we are recommending people have evacuation plans and to evacuate out of the affected areas. With regard to material required, PPE, yes, the emergency management directors in those counties have been for quite some time putting back the appropriate amount of PPE. Should they have to open shelters, and they will, those individuals that come there will be provided adequate PPE should that be required.
Thank you. Yes, sir.
Governor, what do you say to those business owners that depend on this game day traffic going through the area? They're dealing with already a pandemic for themselves. What do you say to them that depend on this revenue that they're possibly going to miss out on?
Well, it's terribly unfortunate that we find ourselves in a situation in which we are dealing with a pandemic, the likes of which we have not seen since 1918, and we have done everything in our power over the last 7 months, oftentimes with great criticism coming along with it, to ensure that our small business owners have an opportunity to generate revenue in their small business. For a restaurant, for instance, in one of our college towns, they continue to have the opportunity to stay open. They can certainly allow guests under the guidelines as they currently exist, and hopefully, if we are smart, and if we continue to wear a mask in public, and if we do the little things, we can get through this as soon as humanly possible, so that we can get back to where we can get more full capacities at our restaurants. Yes, sir.
Yeah, Governor, when it comes to European nations that have far fewer cases than we do, they have in their stadium sports they've chosen to have no fans. Even here in the U.S., most sports have chosen to have no fans. What makes you think that Mississippi, that while we're coming down a little bit, we're still at high numbers, what makes you confident that we can do what other nations have held off on?
Well, I think if you look at what we've learned over the last 6 or 7 months about this virus, if we ensure that individuals, first of all, transmission outdoors is less likely than transmission indoors. We've had venues with outdoor venues with 25% capacity in place in Mississippi for 4 or 5 months, and we have seen some, but very, very little transmission in any of those venues that have been open. And so when you look at the decisions that were made today with respect to seating capacity, we are treating each of these areas within the stadium in a manner consistent with what our EOs have been really for the last 3 or 4 or 5 months. And so we think that that our universities, and I made it very clear to our presidents today, that they have to work hard to make sure that these guidelines are strictly enforced, and I'm convinced that they absolutely will make sure that these guidelines are strictly enforced, and I think if these guidelines are strictly enforced, we will not see significant transmission in our stadiums.
Jeff Pender with Mississippi State has a question.
Hey, Governor. I was wondering if you could give us an update on the Unemployment Security Trust Fund, where that stands. And could you also speak to the decision for the state not to provide the $100 match, so to speak, but to use existing insurance payments?
Yeah, sure. I appreciate that question, Jeff. I don't have the exact number of where the trust fund is today. As you'll recall, it had gotten down to about $310 million. We put $181 million into it, got it back to about $490. We spend between $21 and $23 million a week out of the trust fund, and I think it's been about 3 weeks since we dumped that money in. So my guess is, and we'll get you an exact number, but back of the envelope math, it's probably somewhere between $400 and $430 million today. The decision to not enhance the $300 offered by the feds, you'll remember that this additional pandemic unemployment assistance was 100% funded by the feds when the Congress passed it back in the spring. It was $600 at that time. Some of the things that we have learned is that it would cost us in the neighborhood of $20 million, $20 to $22 million a week to potentially to provide the additional $100 for those who would receive it. It is my impression that you cannot use trust fund dollars to pay that out. And so while the trust fund could not afford it, we would find ourselves spending about $45 million a week, which would mean we'd have less than 10 weeks of money if we decided to provide that additional $100. But I also believe the feds won't let you use trust fund money to do that match, and we don't have an extra $22 million a week, which should go for at least 8 to 10 weeks, which is $160 to $200 million laying around in the state to provide the additional 100. So we also think that we also know that this additional money is going to go away. It's going to go away at some point, short of Congress acting, and even if they do act, it's still going to go away at some point in the pandemic. And so we think that it's the reason that we are encouraging Mississippians, if at all possible, if you get an opportunity to go back to your job, or if you have an opportunity to get another job, we strongly recommend you do so. In addition to that, we did reinstitute the requirement that you search for work to receive unemployment in Mississippi. That was in our executive order that we signed several weeks ago, and that has gone into effect in the last couple of weeks. And so we've got more and more people out looking for work for that reason. There is a work search requirement in Mississippi statute that we had waived through the summer, but that work search requirement is no longer waived.
Bobby Harrison with Mississippi State has a question.
Go ahead, Bob.
It's not unmuting. Sarah Elmore with Mississippi, Y'all Politics has a question.
Thanks, Governor. I just have a question about assuming that Mississippi does get approved for this new program, is there a need for the legislature to come in at any point to handle those dollars? How will that be done and implemented in the state?
No, because of the way in which it's being implemented through the Stafford Act and through employment security, there is no need for any statutory changes for that to occur.
Lucy with Hattiesburg American has a question.
Hello, this is probably going to be quick and easy, and I may have missed it already, but you said when the games resume, only people who are essential to the gameplay will be allowed on the field. Does that include like videographers and press photographers that are documenting what is happening at the game? And what about the press boxes?
Yeah, so we have typically said that all press activities were essential, and so while I don't see it in the order as it currently exists, that has certainly been our stance that press activities are essential, and I don't know that we specifically address press boxes, but we will in the coming days and weeks if we have not. So, but yeah, press can attend games.
Going back to Bobby, see if you can unmute him. Looks like he's muted on his end.
Bobby, it doesn't appear that we're able to unmute you. If you want to shoot us a text or a email on what your question is, I'll be happy to try to answer it this afternoon, but it won't let us unmute you. Well, I don't see any other. I'm sorry. Here's a question.
I have a question from a colleague of mine. On July 20th, the SWAC suspended all fall sports, including football, and you made no public statement about college football being essential. 2 weeks ago, Divisions 2 and 3 of the NCAA canceled their fall championships. Again, you made no public comments about college football being essential. And then last week, you proclaimed college football is essential after the president came out in support of playing football. And in light of 2 Power 5 conferences suspending fall sports, can you clarify if levels of college football are essential? And what factors do you consider drawing that line?
Well, what I would tell you is, as someone who had the opportunity to play Division III basketball, I know a whole lot about playing college sports in front of no crowds. And so, look, here's the reality. We were trying to get to what is as normal a life as possible, and we certainly think that the student athletes deserve an opportunity to play. And I believe that is true, whether it's the Southeastern Conference, whether it's the SWAC, whether it's the old SCAC that Millsaps used to be a part of. And so I think there are safe ways in which to do most activities, and I think that there's a safe way to do college athletics. And so there are those leagues who have made different decisions, and that's certainly their prerogative. But I think we're going to make sure that in our state, that if in fact we have college sports, and I sure hope that we do, that we have limitations in terms of the crowd sizes so that Mississippians can be protected. Seeing no other questions, thank you all for being here on this Thursday. Y'all stay safe out there in Mississippi, and let's continue to wear a mask and do the little things so that we can have college football and a lot of other things that we want to do this fall. Thank you all, and God bless.